Hey guys, this is the second of our videos about the SARS-CoV-2 virus outbreak that's going on. I hope you enjoyed the first one. So we're going to go dive right in and talk about why this virus is behaving the way that it does. So when you look at numbers like this is the Johns Hopkins webpage from last night. These are really scary numbers, 180,000 patients that have been affected by this. But I'm going to tell you, of the people that we've tested, over 80,000, almost 80,000 patients have gotten better from this. So let's really dive down, talk about what's going on, and talk about what we can do right now to get ourselves healthy. So most of you already are doing the right thing. I want you to be self-quarantining. I want you to take your foundational supplements. I want you to eat well, which means really try to avoid sugars and junk. Eat lots of vegetables. Even though you're self-quarantined, I want you to move and exercise often. I want you to sleep well. I want you to take care of yourself so that you're not someone that's getting sick. But this is what's happening with this virus. So remember, 40% of us, especially our kids, are probably going to be asymptomatic with this virus, or they're going to have very few symptoms. Unfortunately, that doesn't mean that they're not carriers. They're still carriers, so we do need to keep everyone self-quarantined. The social distancing that everyone is talking about is very real. There's going to be about 40% of us that are going to have some symptoms. Fever, cough, shortness of breath, myalgias, and muscle aches are probably going to be the most common. As long as those types of symptoms are fairly mild, stay at home, give yourself lots of rest, lots of hydration, get yourself feeling better. If you need our help with that, give us a call, and we'll see if we can't give you some supportive care. There's about 10 to 20% of us, though, where shortness of breath is going to turn into respiratory distress. These are the patients that we need to really watch out for. If you're feeling like you're having shortness of breath and you can't breathe, if you're feeling like you're so lethargic and you're dehydrated, go to the emergency room. This is where you need to be at this point in time. Because remember, this is lingering on our doorknobs for about 3 days, lingering in the air for about 4 hours. It's going to be very difficult to really slow down transmission, but we're going to do the best we can to really socially remove ourselves from other people. But we've got to keep in mind that we've got to do this with our kids and our asymptomatic patients too. So the biggest risk factors, people that are having the worst symptoms and the biggest risk factors are people that have hypertension, diabetes, insulin resistance, people that have already had a heart attack, a stroke, or heart failure. And then you have patients that are immunocompromised over the age of 62, and then unfortunately healthcare providers. So my question for this is why? Why is this virus affecting this subset of patients? And to have that, we're going to go back and do a lot of biochemistry. I know you guys miss my whiteboards. So this is the system called the renin-angiotensin-aldosterone system. This is how our body maintains and establishes blood pressure. So say something crazy happens, or you get very stressed out about something, or you haven't eaten and you're getting ready to pass out. Your body is going to use the nociceptors on your aorta and on your carotids, and it's going to tell your fat and your liver to increase blood pressure. Blood pressure is here for a reason, right? It's meant to support us and help us so we don't pass out. We have to get blood to our brain. So the liver makes something called angiotensinogen. Angiotensinogen makes something called angiotensin 1, along with the support of your kidneys. Angiotensin 1 turns into angiotensin 2, and angiotensin 2 does all these different changes, and guys, basically, your blood pressure goes up, okay? Some of the ways that we can control this conversion from angiotensin 1 to angiotensin 2 is by this enzyme called the ACE enzyme, angiotensin converting enzyme. So when you need blood pressure, your body increases the amount of ACE enzyme that's present. Your body makes more angiotensin 2. Angiotensin does all of these different things to increase your blood pressure. If you've known me long enough, you know that when I talk to you about the body, for every reaction, there is an equal reaction, right? So as this happens, your body can also make something called ACE2, which tells angiotensin 2 to go back and get everything normal again. So this is basically how your body increases and lowers blood pressure. So if you think about it, we tell you, sleep well, don't stress as often, eat less sugar so you don't have as much fat, take care of your kidneys and your liver, right? These are all the reasons why we want to that we do to keep your blood pressure low. ACE2, guys, is where SARS-CoV-2 enters the body. Remember when I told you it stays obligate, right? And it's not until it enters a host cell that it becomes alive. This is the point in which this particular virus is entering our cell. So people that have more blood pressure are going to have more ACE2, hence are going to be more susceptible to this virus. That's what we're thinking anyways. What we know is that this is where it enters the host cell. Once SARS-2 enters that ACE2, then there's also the creation of what we're going to call a cytokine storm. As you know, inflammation is everything. The second blood marker that they found in patients in China for this disease was an elevated cardio-CRP. We all understand how important that is and how important inflammation is in chronic disease. Now it's really affecting us in acute disease. So what happens is ACE2 receptors are also found in the lungs and also in the heart. And so when this virus is affecting us, it's really causing respiratory distress. And it's causing a lot of issues with the heart. That is what we know. We know that people that have hypertension, diabetes, heart disease are at high risk. Add to that someone that might be elderly, someone that might be immunocompromised, and that's going to really heighten that risk for them. So those are the people that we're really watching out for. Now here's what's interesting, and this is where we turn into some speculation. Those of you that have blood pressure issues know that two of the probably the most commonly used drugs in America are ACE inhibitors, which are all the blood pressure medicines that end in pril, and also angiotensin receptor blockers, or ARBs, which end in sartans. Right now, guys, we don't know what those drugs are doing with this virus. We know that they're all playing in the same playground. We don't know if it's a beneficial thing to be taking ACE inhibitors or ARBs, or if it might be detrimental. And every day there's new research on this. This is the reason why we're doing these video snippets. If you have high blood pressure, and especially if you're taking one of those types of medicines, keep watching our videos. I promise to keep you posted as I see information coming through. If we need to make any kind of changes, we will. For right now, what I will tell you is this. Keeping your blood pressure low is going to be very important. Making sure that you're healthy is going to be very important. Eat your veggies, please. Get more potassium in your bloodstream so that your body can manage that. Take your magnesium if that's something that you're supposed to do. Take your foundational supplements, but sleep well. This is really important right now. Lack of sleep is one of the worst ways one of the best ways you can elevate your blood pressure. So eat your veggies, sleep well. This goes right back to eat well, sleep well, move well, and poop well. So really be good about that. These are all the other places where there are ACE2 receptors. So when you go down the list of symptoms, there are some GI symptoms that people are having when they're affected by this. There's some kidney symptoms. You might have seen on Facebook pages, I know my office manager tells me these things, that a lot of people are saying, hey, don't use ibuprofen if you have a fever, use Tylenol first. That's because there's ACE2 receptors in the kidneys. And as you guys know, ibuprofen, Aleve, NSAIDs are often have to go through the kidneys in order to get detoxed. So I would agree with that. If you have a fever, try Tylenol first. If you have a high fever and we're trying to keep you out of the hospital, use whatever you need to do to get that fever down. But let's start with Tylenol first. And then of course the blood vessel. All that talk from me about a healthy endothelium when we do your advanced blood testing, this is where it counts. So for those of you that know, when we talk about advanced cardiovascular testing, we talk about a healthy endothelium, and the way to maintain that is to reduce inflammation, to reduce insulin resistance, to optimize methylation pathways, and really to just stay as healthy as we are. This is the reason why we do functional medicine, is when something like this comes at us, we're really well protected to take care of ourselves. So until next time, stay well, stay healthy, and if you have any questions, don't hesitate to call. Thanks.